My name is Jessi Welcher. I am a registered pharmacy technician at Shoppers Drug Mart. So a typical workday as a registered pharmacy technician in the community setting, we receive prescriptions, check them for legal requirements and validation. We then enter all of the data from the doctor into the computers. It's then verified by a pharmacist, filled typically by a pharmacy assistant, and then we take part in the final checking of products. So I have wanted to work in the pharmacy setting for my whole life, pretty much. I started working as a cashier at my local drugstore back home when I was 14, and then eventually got a little bit of experience putting away inventory in the pharmacy, in the dispensary, and I just found myself always reading the drug names and trying to figure out what they were for and what they did. And then when I turned 16, they had brought me in to the pharmacy and allowed me to work as an assistant. So just filling prescriptions, pretty much counting the medications out. And I got familiarized with the common drugs doing that. And I just knew that that was the career path I wanted to take from there. And then, yeah, I continued working there and then eventually moved to Saskatchewan and took the program to become a registered pharmacy technician. So what I liked about the Sask Polytech pharmacy technician program was that everything was hands-on. You do have your learning from a textbook, and then you take all of your learnings and go into the lab and you're able to demonstrate what you've learned. And hands-on learning has always been the way I learned, so I really did appreciate that portion of the labs. After your first year, you have a 1-week practicum in a community setting. The 1-week practicum is mostly over-the-counter products, so you're helping patients select products, asking them questions, kind of getting a very basic knowledge of over-the-counter products and a little bit of exposure into the dispensary. And then the second year, you do 2 4-week practicums, one in the community setting where you are taking part as an actual pharmacy technician, and then also in a hospital setting where you are doing sterile compounding and preparing drugs for med carts, taking med runs, things like that. So when I left Sask Polytech, there are both provincial and federal pharmacy exams to write. So a few months after graduating the program, we wrote, it's called PEBC, and so that is your federal exams. So there's a 2-part exam. One is a multiple choice, and then one is a hands-on exam. So it's written into 2 portions. Once you've passed both those, then you go to write your SPTA and your jurisprudence exam, and that is all through the Saskatchewan College of Pharmacy Professionals. After graduating and finishing both those exams and passing, I registered as a technician, and then I started my career at Shoppers Drug Mart. And then about 6 months ago, I recently joined the Saskatchewan Cancer Agency at the Saskatoon Cancer Center, working as an oncology pharmacy technician. Successful pharmacy technicians are people that are very goal-oriented, compassionate, and really just want to help people at the end of the day. Being a pharmacy technician, you don't necessarily work right at bedside with a patient, but you do still get the same wins helping prepare before it sees a patient. So in pharmacy, we talk a lot about accuracy and efficiency, both very important skills and very important in the pharmacy setting. And when you can find a balance between being 100% accurate, but also being quite efficient, you really can get a lot of work done in a fast amount of time, but also have everyone being safe at the end of the day as well. So no pharmacy would run solely with one person. We are built up of pharmacists, pharmacy technicians, pharmacy assistants, and we do have cashiers as well who solely just work at the till. But it really, when you have a team that's working together, it's what makes the dispensing process go by quickly, and it makes it go by safely. And that plays a huge part in pharmacy. I love how rewarding my career is. There's always going to be challenging days when you work in healthcare. You see every sort of patient, from kids to seniors, everybody of every walk of life. But the days when someone comes and tells you how much you've made an impact in their life, or how much you've helped them, or how they're doing better, or treatment is working for them, those days they really hit home and just make it all worth everything. Every community pharmacy is looking to add a pharmacy technician right now. Our scope of practice is expanding every single year. We're able to do more. Recently, we have now, with injection training, I'm actually today doing flu and COVID injections, and I see that expanding in the future. It seems every year they've just continued to expand both our scope of practice as well as the pharmacist scope of practice, which just allows us to do more in the dispensing process. My advice would be to not give up. There is a lot to learn. There's every single drug you see around. You have so much information to learn about, but once you start learning, it just keeps coming, and the profession is forever going to be new information, and you're just continuously going to be learning. But that's also what I love so much about the career, is that every day I learn something new. Put yourself out there and apply. For an example, in our community pharmacy, we would absolutely hire a high school student to work part-time just to get experience as an assistant. And that would be something like counting medications, just kind of familiarizing yourself with what this career even looks like. And that can really tell you, you're gonna walk in and you're gonna go, oh, this is something I find really interesting, or you're gonna go, you know, maybe this isn't for me. And doing that now is gonna help guide you as to what you wanna do for the rest of your life.